As I mentioned, that's because the energy which you are getting it from fat, which is accumulated in adipose tissue around our abdomen. So in most of the cases, and the result which we have obtained from the patients and from the following this program, we found that there is loss of weight, there is a decrease in the blood sugar level, there is a decrease in the cholesterol level, there is a decrease in triglyceride level, there is a decrease in low density lipoprotein, which is bad thing, and increase in high density lipoprotein. So it goes simultaneously, and then if there is a time, I've got some other illustration which I can really show it.
But actually, Professor, so we can move on, I'm sure a lot of people are very anxious to know what phase 2 is. Now, we just mentioned that phase 1 consists of 2 weeks, and that you're on a certain type of program, or certain type of foods, actually, or that you follow, reducing carbohydrates.
True.
So that's phase 1.
Yeah.
And what about phase 2?
Phase 2, this followed 2 to 3 weeks or 4 weeks according to the weight. If patients' weight still, we can go with them to decrease the good amount of weight. There is no harm, there is no any case reported that there will be any effects on these things. And I was surprised in the last week some people were attacking. There is some problem, but they don't have any evidence to tell there is some side effects, except in long period that I could come and explain about it.
But
now,
Professor, maybe sometimes whenever a patient goes on a diet, they will feel uncomfortable because you are cleaning your body from all the toxics that are inside. Therefore, it's for sure to suffer from headaches, to suffer from mood swings. These things are natural, isn't
This is beautiful. This is when patient comes and tells me, well, doctor, after 3 days, I felt I'm getting headache, I'm getting this. I know the program is working with them. You know, that's really makes me very happy and very pleased. I know the work is going well. But 5-6 days later, patient is really feeling something else completely. And in very few cases, really, you will find this one. I think let's go to the second phase, which is ongoing diet.
Okay.
Okay, that's
before ongoing diets and before phase 2, because, Professor, we have a lot of calls that are coming into the studio. Hello, Helen, you're on the air.
Hi, how are you?
I'm fine. How are you?
Very well, thank you.
Good.
I'm enjoying your program very much, and I'm
you.
also enjoying listening to the doctor.
Thank you.
I think he's very informative, and I really appreciate that.
Do you have any questions?
My question to the doctor is, 5 years ago, I was put on a diet simply to reduce my weight. I wanted to lose 10 kilos, and I managed to lose 20 by going on a grapefruit diet, whereby you're consistently taking grapefruits in the morning, midday, and at night with your diet. And, of course, there's cutting of the carbohydrates tremendously and boosting the proteins, okay, and the fat to a certain extent. So is that also recommended for anyone that just has no diseases, but they just want to trim down?
Okay. Well, all right. Thank you, Helen, for your call.
Thank you.
Good night.
Bye-bye.
Bye. Okay.
So I think Helen is going in the program, and she's getting quite a beneficial effect of it. Yes, this could work with anyone, really, who wants to get slim. Good that you brought me to the point that this diet, I think we can continue, this diet or ketogenic diet is a good therapy for the patient who has got epilepsy, that the patient got seizures, who are really in a very bad position and where the proper treatment is not influencing them. And they found that there is a lot of literature. Yesterday, as I was telling previously, that yesterday I was going through the literature and I found that cases and thousands of cases is making the patient to improve, especially in the children, for a period of 2 years and even more. And the side effect was almost negligible. There was, of course, certain things can occur for prolonged dieting, but you could prevent these things for more problem which is facing the patient. So I think, as Helen was mentioning, it could be applied to almost everybody, really, except the patient who has got renal diseases, who got renal problems, the patient who has got really and liver problems. So here, that's the reason. Whenever the patient comes, we have to check up all the things with cholesterol levels, with the liver profiles, and with the renal or kidney profile, in order to see the situation, and of course patient, him or herself, inform us whether the patient has got certain diseases, and accordingly we can go to this program.
Right. Well, Professor, if we can just talk about phase 2 and then take another phone call, because this way we're not going to go through the 4 phases. There are lots of phone calls, but we'll talk about phase 2 first.
Okay. So the phase 2, call it, as Dr. Atkin was saying, is ongoing.
Ongoing. Okay.
And this ongoing, here, as I mentioned, patient start taking more carbohydrate every week.
So you
increasing the amount of carbohydrate by 5 grams to 3 grams per week. So maintaining his weight loss also during that phase, during that period, till this phase might go for 3 months, 6 months, 7 months. We don't want to make patient unnecessarily unhappy. We want the patient to feel that he or she is doing quite good job by taking good carbohydrate, by keeping the weight loss, and instead of losing 4 kilograms, for example, per month, I don't want the patient to lose 1 or 2 kilograms per month.
Take his own weight.
His own way. And that's the phase 2. And of course, patient will himself realize that he's stationary in the weight or decreasing his weight level. So accordingly, this is the second phase.
So basically, the second phase is not to a limited time span. It can be 2 weeks, it can be more.
Absolutely. Absolutely.
And